Good morning, everybody. It's been a year since I've been up here. A year is a long time for some people, maybe a short time for others, but there's been a lot going on with us. In government, I've learned, this is my 27th year. A lot of times there's, if you're going to sit there and expect thanks, you're going to be waiting for a long time. So one of the things to realize that people appreciate what you're doing is you get additional, what we call FTE, which are full-time employees, all right? So I'm proud to report to you that in the past year, our ceiling in the Milwaukee regional office has gone up by 41 full-time employees. So, and that's despite the little hiring freeze that we had, a few months back. 41 of those are veterans from Wisconsin. Right now, we're literally over 50% of our employees are veterans. As we take on, a year ago, we've transitioned to being paperless, and I've got all the file banks out of there, and with all this hiring, I literally have wall-to-wall people. If they were to say, hey, I want you to hire 30 more, I probably have to find another building. But that's a great position to be in, and I want to stay in that position. I want the office to be recognized as one of the best, if not the best, in the country, in that we get things done here. Right now, on average, to process an original claim, it's taken 95 days. We have one of the lowest appeal inventories in the country in Wisconsin, and we want to make it better. And I can't do that alone because, especially with appeals and getting veterans to hearings, and I've been able to get the BVA, Board of Veterans Appeals Travel Board, out here 3 times this year. 3 times. I've never been in an office, regardless of size, that they've been able to come out. And when they come out, that gets those appeals moving even more. And if I get them to come out 6 times, I'll do it. But that's what I want to do. Morale is high. We're looking forward. We're still taking on a little bit more of the national mission. A lot of dependency claims from across the country. We're also taking some review exams from across the country, but we're doing it. And they know when they need somebody to help them out, they're going to look toward Milwaukee. And I want to keep the relationship we have. I love being here. I love interacting with you, being a part. One thing I'm not really good at is mind reading. So if you have an issue or something, if you can't talk to me directly, send it through Brian. He knows that I'm there. He knows where to find me, and we'll make it happen, and we'll get back to you. Thank you again for having me.
People heard what Dr. Shulkin said when he did his press conference at the White House, talking about what some of the issues are in VA. He called the condition critical, but that we are working on them. And what I want to tell you about is some of the things that we're working on. I want to be sure that each and every one of you know and shares the accesstocare.va.gov. That's a website that tells you exactly what the waiting times are for new and established patients at any site of care across all of VA. So that means if you're in Wisconsin or you're in Illinois or you're in Florida, you can look at that website and see how long it might take you to get an appointment if that's needed. We're also committed across the entire VA, and I will tell you that this is true at each site of care in VA, that we make every effort and that we have committed to make sure when you have an urgent need to be seen that day, that is done. Now, it might be seen, it might be talking to somebody, it might be getting a prescription, but if you have an urgent need, please make sure that you contact your local VA so that we can do whatever we can to address those needs. I worry sometimes that most of what you hear about VA can tend to be negative because what gets in the press is the OIG reports, all those things that attract the media attention. I know, for example, yesterday there was a report released on opioid usage, and that was in Poplar Bluff, Missouri. But as you all sitting in this room know, the first place that real opioid problems were identified, and I would say this in the United States of America, because it is not just about the VA, it's about healthcare in general, was right here in Tomah, Wisconsin. We have done so much to change the way that we prescribe opioids. And I will tell you that Tomah and Vision 12 are leaders across the VA in terms of monitoring how it is that we handle opioid prescribing. We're also looking at trying to modernize our systems, whether that be our facilities, our medical record, which Dr. Shulkin has promised to have a decision by the end of July to look at where we're moving, if we're going to be going to keeping our current system or moving to something from the private sector. We're looking at how is choice going to be changing. I know that's a big frustration, and what I hear from people already last night and today is we need to make that better. One of the things the folks from Madison were not able to be here today, but I can share with you that they were selected to be a pilot site. So at Madison, we're going to be hiring some additional individuals so that we take over what the TPA is currently doing. So instead of you having to call Choice to make an appointment, people at the VA will make the appointment in the community for you. That's big. And that's going to help with the coordination of care. That's going to mean that you get your appointments quicker. Unfortunately, we probably are not going to be able to take that on right away, but it will be this calendar year. And that's the direction the entire VA is moving. Rather than hiring somebody and having them be the ones to make the appointment, we need to make the appointment. We need to get the medical records. We need to make sure that the veterans are seen as timely as possible.
You know, first off, I really want to extend just a genuine thanks to the DAV organization for what you all do for our veterans. It is, thank you. It is so humbling to see. You know, I was looking at the statistics from last year, and this is just the Milwaukee VA system, right? The eastern side of the state. That over 400,000 miles, 400,000 miles were driven by DAV volunteer drivers to get patients to and from their appointments. And when we look at the number of veterans served, this is perhaps even more remarkable. Over 23,000 veterans were served in fiscal year 16 to go to and from their appointments. And to put this in scope, we take care of about 64,000 veterans across our healthcare system. So that's over a third. I mean, think about that. Talk about access to care that your organization provides for our veterans that otherwise may not have gotten care at all and certainly wouldn't have gotten care at the level that they do to be able to get the evidence-based, proactive, preventative care that we offer. So huge, huge thank you. You know, I find myself kind of reminiscent, particularly this year, because of when I look at how much the VA has grown and evolved over the years. This year, the Milwaukee VA is celebrating our 150th anniversary, which is a huge, huge deal for us. We've had events throughout the year, but it was back in 1867 when we got our first veterans. There were 60 veterans that first arrived for care at our soldiers' home in 1867 from the Civil War. So we are celebrating that, of course, all year long. But I think about just how the infrastructure has grown in terms of volunteerism, as I mentioned before, and my goodness, healthcare. You know, the commander mentioned some things that are going on, but you know, our regional spinal cord injury center, we probably have the largest collection of adaptive sports equipment and story after story in the country. We opened our Fisher House last year, just before I arrived. And since then, we've served about 650 families to allow them to be close to their loved one while they're getting care. The commander mentioned our parking structure. That was actually the first thing, my first couple of weeks on the job, I got to christen that. And again, from creating an environment, an inviting environment for veterans to come to care, to work on prevention, it's very important. So I want to talk about a few things in terms of where I think we're going, where I'm trying to move the Zablocki EVA system. Certainly, number one is lots of ongoing construction. Second parking garage is going to be, is very much active now and is going to be up in the fall. We are also going to be activating soon 2 new greenhouse buildings. This is going to be brand new state-of-the-art space to take care of our long-term care patients. So essentially an assisted living model. It's gorgeous. If you have an opportunity, I invite you to come. And then we're also going to be breaking ground on a new urgent care center that's going to be contiguous to our emergency department. So stay tuned for that. So strategically, a big priority of mine has been, it's actually very pertinent to this area, it's to expand and deepen services in our Green Bay clinic. For those of you who haven't been, it's a gorgeous clinic. It's 160,000 square feet. And the good news is we have space to grow and to see more patients. So this is a big deal for me, for us. Thanks again to the town hall that Ms. Oshinsky mentioned and feedback from the community. I'm happy to say that we brought a mobile MRI up this past March, 2 days a week, that is booked solid with up to 18 appointments a day. That's new service. And just this week, I got confirmation that we have a handful of new providers that we're bringing on board. I'm very excited about this. We just got confirmation yesterday that we have a full-time hematology oncology doc that's going to be starting. We have, thank you. We have a part-time general surgeon that's going to be starting, a full-time psychiatrist, and a full-time primary care physician. And that's in addition to, we've recently hired 3 other primary care providers there. So you're going to see more and more in terms of deeper services. And this is what I hear in the community, that a lot of our veterans don't want to come to the city, they don't want to come to Milwaukee, they would rather come to Green Bay. So we're trying to build up those services. The last area is really kind of a lead-in in terms of the community engagement that I mentioned. This has been a big priority for me to get out in the community and spread the word about the great things that we're doing, about the great care that we're providing, to invite more veterans into our healthcare system. And so I've approved for 3 different campaigns, I'll call them, to help attract veterans and help people understand what we do. One of them is going to focus on the Green Bay area, letting people know about the new services. So, for example, later this month, we're going to have radio spots. We're going to have a couple of TV spot commercials that we're putting together. We're actually getting a deal where 2 stations are shooting it for free for us, so that's fantabulous. So that's one domain. The second one is for our 150th anniversary. In fact, today we have a big event going on at the medical center. WKLH is on site broadcasting live the Dave and Doreen show from 5 a.m. to 10 a.m., so they're still there to help us showcase and advertise the event that we have tomorrow. If anyone's available, please come. It's 9 to 5. We're going to have reenactors and bus tours, and there's a Civil War era root beer stand that I'm very eager to try. We're going to have, there's a 50-foot submarine replica from the Vietnam era that's going to be on campus, so, and military vehicles, the whole 9. So please come. That'll be really the second campaign that we're working on. And then thirdly is suicide prevention. And this one we're starting to tee up now, but you may have heard the Secretary talk about suicide prevention as his top clinical priority. This is a big deal. I think hits home for me. I grew up in the VA being trained as a clinical psychologist. And no doubt, we can never do too much in terms of saving the lives of these veterans. Thank you. So see more campaign material and so forth there. I think when we look at the literature, we know that 14 out of the 20 veterans that decide to take their lives each day are not engaged in healthcare in the VA. We can do better than this. We provide world-class mental health care. We really do. Thank you. And I'll tell you, what I've found is, oftentimes it's not the veterans themselves, but it's their family, friends, neighbors that bring them in for care. And I think we need to do a better job of educating the populace about what are the warning signs of suicidality. How do you ask the right questions? What happens when a veteran makes a vague statement that they may not be around in 6 months? A lot of people will walk away uncomfortable. Well, we need to give people the tools to ask the right questions about, well, help me understand, are you having thoughts of suicide? Do you have a plan? Have you thought about how you might do it? Do you have a gun at home? Things like that. So I think there's a lot of tools that we can equip not only veterans but the folks around them in order to help us solve this problem. So with that, again, I just want to finish by saying thank you so much for all you do for our veterans and being our partner. It's quite an honor for doing what we're doing.
It's truly an honor to be here this morning to listen to all the great commentary and all the great work that's going on. So I want to bring you greetings from the governor and from the department. And certainly I'm really pleased to be joined by Gary Meyer, who runs our Office of Veteran Services, who has been a strong member of your organization. I'm honored to serve with Gary at the department. We in Wisconsin have some, I think, very interesting and very positive times. We have a growing economy now that, with an unemployment rate that's at 3.2%, that's the lowest it's been since February 2000. Our veterans' unemployment rate is now down, as of last month, down to 2%. And it usually averages about 3.8, so we're very pleased to have a trend that is positive. But certainly that's not good enough. And we know at the department, as we continue to build workforce, to develop workforce, to reach at individuals who traditionally are not in our normal workforce, as we work with people on reentry, people who receive social services, people who are in our DVR system, that our challenges are great. And we also recognize that the transition from military to civilian life is not always easy, that there's an adjustment that sometimes needs to be made. And that's where I want to give compliments to Gary, compliments to your organizations for working with us, to work with our veterans as they re-enter civilian life. The governor has charged us at the state and at the department with a couple of initiatives, and I want to talk a little bit about those. The governor established the Wisconsin Veterans Employment Initiative a year or so ago, and the Council on Veterans Employment, both to focus on assisting our vets in civilian life and also to increase the number of veterans who work for state government. I'm pleased to say that within our Job Center site you can go on there, and we have Wisconsin Jobs for Veterans, a special unique portal that you can come in. We're one of the few states in the union that has a unique portal for state employment, where veterans can come in and get an expedited review of their applications and expedited employment within the state. We have, to date, 129 veterans with a 30% or more service-connected disability that has been hired by state agencies. And that's at an average wage of about $21 an hour. We're also focused, if a veteran who has a 100% disability, a permanent disability, and is disabled, their spouse is also eligible for priority service from our. And we continue to provide support to and incentives to employers who focus on hiring vets, that we provide up to 50% of job training monies to assist them with the training of those veterans. And we also have the Wisconsin's Veteran Grant for employers of $10,000 over 4 years. And we continue special outreach. Gary and his staff have done some marvelous things in the city of Milwaukee, I know, to do outreach to our veterans population. And at the department, we work very hard to walk what we talk. So if you look at Gary's staff, 100% of them are veterans with disabilities. And we continue our efforts. Thank you. And then we continue our efforts at the department to recruit and hire veterans. But we can't do that without your help and your continued support. And the support of our partners at Wisconsin WVA, who have been great partners with us, our partners at the DOL, who have been wonderful to work with. But I want to assure you today from our department, the Labor Department of the state, you have our commitment and our focus to continue to work with our veterans community, to work with our veterans, to provide them every opportunity and every support we can to assist them to make the transition, to help them and their families find family-supporting jobs in the state of Wisconsin. And again, on behalf of all of us, I thank you for your service, the service that makes it, for all of us, that has made it our ability to stand here and talk before you, our ability to have the freedoms that we have, our ability to have this great nation, and our ability to have this enterprise system that allows us to create jobs, jobs which I hope are populated with our veterans. So thank you.